Hello, today we are going to be placing a sterile catheter into our patient. Today we're going to assume that our patient is female. So beginning off, you would wash your hands, of course, make sure nice and clean. You would also start by cleaning off the patient using sometimes the kits come with alcohol swabs you can clean it with, but first soap and water works best. After that, you instruct the patient that you will be performing this procedure. Let them know that there's going to be some pressure and it could be a little uncomfortable, but just rest assured it is for the best. So starting off, we'll get our catheter kit here. And of course, you only want to touch the outside one corner edge here by 1 inch. That way, everything else stays sterile. And you always kind of want to open away from you as best you can, not to cross over your sterile field as best as possible. Okay. And then kind of grab the drape without touching the contents of the box. And then you want to place the drape with the shiny part down. You kind of want to waft it a little bit, that way you don't go over your sterile field. I'm going to scoot the patient a little closer. And then you want to grab your sterile gloves. Once again, just touching the gloves, not touching anything else in the box. And then, like I said, the outer 1 inch of the border again. And then for this gloves, you want to start with your right hand, and then you want to pinch the outside of the glove. That way you don't touch the part of the glove that's sterile. So you're going to pinch, and then slide your glove in. And then you can readjust it after you get the second glove on. And then for the second one, you want to kind of use your 2 fingers. You want to scoop underneath the flap of the glove, and once again, just slide your hand into it, raising it up, that way you don't accidentally touch the table or the patient with the sterile glove. Okay, now with this stage, you can adjust yourself accordingly. And toss that out of the way. And then now, nothing's been touched in the package besides the drape and the gloves. So everything in the box is sterile. So we're going to get everything prepped and ready to go. We'll place this drape above the patient. Once again, you kind of just want to waft it, that way you don't go over your sterile field. And then you're going to get everything set up before you actually start touching the patient. So you want to get your betadine set up. We'll leave that there, and we'll say that, of course, it's opened and ready to go. And then you want to grab your lube as well and place it in a position that's very easily to be accessed with your tip of the catheter. And we'll say we'll put it on the corner of this box in here, and then you can toss this away. And then we'll get these saline ready for our pump, for a balloon. And just remove the cap and then place it onto here. Making sure you're watching to make sure the catheter tip does not fall out of the box and touch the patient or the bed or anything. Make sure it's nice and sterile. Now we're going to go ahead and get ready to touch the patient. Like I said, the patient is female, so we're going to start by kind of spreading labia and make sure we can find where we want to go. So you take your left hand, and right now we're spreading the patient, and then we're going to grab our right hand that's sterile. This hand is no longer sterile, and we're going to grab it. Remember, this box is already open, so we're going to grab our first one, and we're going to swipe the furthest away, and we'll swipe it. And you want to make sure you go around your sterile field, that way you don't say anything drops, or you don't want anything bacteria, anything falling into your box. And then we'll throw it into the trash can. We'll grab our second one. Once again, we'll go to the left side and swipe it. And then once again around your sterile field, and then throw it away. And then the last one will go right down the middle, and then around it, and then into the trash. And then we can take this package, since it is still sterile, and throw it away. And then we'll grab our tip of the catheter. Also make sure we don't touch anything that's not sterile, like the bed or the patient. The legs, if the patient had legs, it would be the left and right side. Just make sure you don't touch it. And then you're going to dip in the lubricant. And then from here, you want to guide, make sure and nothing touches the patient or the dirty drapes. And you're going to start, make sure your angle's up still. And you want to start inserting, but you want to make sure you insert at an angle, kind of upwards. And then once again, you kind of want to like fish it in, kind of like so, not kind of just going in. You want to make sure you just kind of wiggle it in like so. And then once you get to a certain point, you're going to get urine return. After that, you want to go about another few inches in, maybe about 2 more inches, and then you stop. And then you can let go of your right hand, but with your left hand, you want to hold on to the catheter. That way it doesn't come out. And then you're going to grab your saline lock here, and you're going to inflate the balloon with the entire 10 milliliter syringe. And then we'll inflate it, and then you can remove the cap. We can toss that away. And then you want to have like a stout lock in place, that way you can strap it to the inner thigh. And then you'll place it into there, that way it relieves tension on the actual part that's inside them. Leave it there. And then you want to grab your specimen container, and you can grab it from the bag, since the first batch, as soon as you finish completing the first urine that you get out of the bag is sterile. And then from here you can also let go of the patient, but remember that this hand is none of the hands are really sterile anymore, but you are finished with the procedure. You can make sure not to touch the inside or around the cap, that way no bacteria gets in. And then you can get your specimen, and then you grab the top of the container and screw it back on. And then you can set this aside and give laboratory a call, and they'll come pick it up. And that is how you do a sterile catheter.